stuff. We'll talk about the arms that actually allow you to pick up stuff when you get this foundation someplace, and we'll talk about this head and neck muscles and things like that that help your head rest on the body. The reason we didn't do any of that stuff yet is that it's our firm belief in structural, architectural anatomy that really the spine, hips, legs, and feet are what really create the structure of the body, and the head can never be okay if the back is not okay. Most chronic neck problems, now don't get me wrong, they can come from a car accident or something, but most chronic neck problems are actually because of back and hip and feet problems. So that's why we went this route. That's why we've been working our way down this building, and we're eventually going to get to the foundation. And the muscles that we are going to be working on now, are the muscles that actually puppet your feet. And I mean this in the same way as when we get to the forearms. I do have muscles in my hand. I do. But most of the power for my hand comes from muscles in my forearm whose job is to have long strings, we call tendons, move those fingers. And the exact same thing is true in your feet. The muscles in your legs really move your feet. They don't move your leg. They're in your leg, reaching out to your feet to move your feet. So in a way, by studying the muscles of the leg, we're starting to already go into feet, if that makes sense. Ms. Hendrickson, you raised your hand.
Yeah, I was just thinking, we did go over some neck muscles. Is there a lot more that we haven't gone over? We just did mostly the ones in the back.
Yeah, you're right. We did the ones in the back because they're all part of the spine. We haven't done things like, now you're making me think.
We did the splenius capitis and
Yeah, but we didn't do things like the scalenes and stuff that hook into the sides of the neck. And by the way, you guys should be semi-familiar with all that because we've mentioned it, but we haven't gotten into some of that. And we haven't done facial muscles, and we do care about those.
Yeah, facial muscles.
So like your masseter, your temporalis, your pterygoids, your medial lateral pterygoids, things like that are actually fairly significant muscles because people get TMJ and things like that. Yeah. We got more. But you're right. We put it on the end of the course because, it's a very strange way. Your feet are much more important than your head, structurally speaking.
Right.
Yeah. So, anyway, but yes. Yeah, you'll see. We're heading there. Anyway, so Ms. Hendrickson, since you're on, Ms. Hendrickson, when we last left you guys last year, we were talking about the muscles of the lower leg. And we said you had 6 in back and kind of 5 in front. You have 11 muscles of the lower leg, right?
Mm-hmm.
Do you remember what, on the posterior leg, can you tell me the 6 muscles there? You might want to start with the 3 calf muscles.
Okay, so there's the gastrocnemius, soleus, plantaris.
Yes.
Then the tibialis posterior.
Yes.
And then there's the I want to say there's is that the one with 2 different names, or is there a different one that has 2 different names?
No, I know what you're talking about. That's a different one. That's on the side. But when my toes get pulled down, we call that. What do we call that action?
That is.
Yes. Yes.
That's a.
Say it.
Flexor longus.
Good. So flexor hallucis longus is pulling my big toe down, which has to happen from the back of the leg. And then there's flexor
digitorum longus.
Yes, and that is the 6 muscles of the back of the leg. And now we've got 5 that are on kind of the front and the side, anterior and lateral compartments. And what are those 5 on the front and side?
Okay, so there's the tibialis anterior.
Yes. And then when my toes come out,
extensor hallucis longus and extensor digitorum longus.
Yes. And now you've got the 2 muscles that have the 2 different names.
Okay. Say it's tibialis or something.
Fibularis?
Peroneals or
fibularis?
Fibularis.
Yeah.
Okay.
Peroneus longus and brevis or fibularis longus and brevis. Yeah. Good job. I think that's right. Yeah. Miss Rader, was that right? You're nodding your head. Good. So, Miss Rader, can you just, because we kind of stumbled through that together a little bit, Miss Rader, can you sum that all up for me? What are the 6 muscles of the posterior leg?
They are the gastrocnemius, soleus, and plantaris, tibialis posterior, flexor hallucis longus, flexor digitorum longus, and then the front. Okay. Front is the tibialis anterior, the extensor digitorum longus, extensor hallucis longus, and then on the side you have the peroneus longus and brevis, or fibularis longus and brevis.
Beautifully said. Beautifully said. Awesome. So we are heading down to that area, and all of those muscles, is that true? All of those muscles, yes, move the foot. Right? Some of them cross over your knee, can actually help with the flexion of the knee. But all of those muscles, their main job is to create a plantar flexion or a dorsiflexion or a flexion of your toes or an extension of your toes. That's what they all do, those 11 muscles. So all 11 muscles that live in your leg are there to manipulate your foot. So that might be where they live, but where they reach is what's important, right? Because that's what they're going to pull on. Cool. Let's look at those. We're going to look at the calves today. And we're going to look at a funny little muscle we haven't talked about that is the key to unlocking the knee. And I need to try to kind of do a little demonstration for you guys here. And I hope it will make sense. Mr. Singletary, please.
If you lose on the test for the fibularis or the peroneus, do you want both answers?
Well,
Like the
are you talking about the year-end
peroneus
test kind of
longus
thing?
or the fibularis longus? Yes.
If both answers are available, yes, but they're not going to be available, sir. Like there's no trick questions on the year-end test at all. I don't want to test your ability to take a test, right? Unlike, I feel like the book. Some of you guys bring me stuff from the book, those tests, and I'm like, you're right. Like it's almost testing how clever you are at figuring out the test. The year-end test is not like that. We want to know that you just know. And so we don't put anything. There's even stuff where I'm like, oh, this picture's not really clear. I don't even put the thing it could be, because if it's not clear, I want to know what you know, right? So it's not like, oh, you didn't pick both, you got it wrong. It doesn't set you up like that. Okay?
Okay.
All right. I want you guys to think about something here. This is kind of hard to visualize, but I want you to think about it. This popsicle stick is a bone right now. This popsicle stick is a bone right now, and it can bend right here. This is its joint. We see it bending, right? That's what it's doing. This is a muscle. Muscles can only do one thing, right? Contract. So when it contracts, it does that, right? It pulls the popsicle stick up. That makes sense, right? Something we don't ever think about in structural anatomy is if the muscle is running right alongside the popsicle stick and I pull, it can't lift the stick up because it's actually pulling the stick exactly this way. It's not until the stick gets up a little bit that then it can pull it. If the muscle is running right alongside the muscle, right even with it, pulling it pulls the muscle this way. The bone this way. It pulls it this way. It can't actually bend at this joint because it's pulling it right here. It needs to come up a little bit, and then when the muscle pulls, it'll move. But if it's right down here, I'm pulling on it right now, it doesn't go anywhere because the action is this direction. I need something up here to get it going. Then it can pull it over. Well, this happens in the back of your legs with your hamstrings. Your hamstrings are set up like this. They're going up to your hips like this. And when they pull, they don't actually lift your legs up until your knee starts to bend. Once your knee bends, your hamstrings can pull. Otherwise, they're just pulling the leg straight up into itself. You have to bend your knee a little bit. And so there is actually a muscle that unlocks your knee and bends it just a little bit. And it's called the key that unlocks the knee. and it's there for that reason. You also have this happen in your shoulders, by the way. A lot of people don't realize this, but my middle deltoid is hanging off by a acromion process, and in many ways it's going straight down, and when it tightens up, it just kind of tightens up my shoulder. I need my arm to get out a little bit for it to pull my arm up. And that's what your supraspinatus does. Your supraspinatus initiates the movement of your arm just a little bit so that your medial delt can get a hold of that humerus. So it kind of unlocks the shoulder as well. So this is where we're kind of getting into advanced anatomy. It's really fascinating. Anyway, we're going to talk about the 3 calf muscles. And we are going to talk about the popliteus, sorry, which is the key that unlocks the knee. It's in the popliteal region. That's why I misspoke. All right, let's share this slide presentation if I remember how to do that still. And let's see what we got. There we go. And all right. For those of you that forgot everything over break, those are feet down there. Yep, good. Good, you have. Glad we're seeing some nods at least. That's always good. Hey, let's talk about some stuff. Who can tell me what kind of bone this patella is? What kind of bone is it? Miss Hendrickson.
Sesamoid?
Yeah, it is a sesamoid bone. What is a sesamoid bone, essentially?
Oh, it's like not directly attached to another bone, or it's
Yeah,
floating?
yeah, it's kind of floating. It's wrapped in tendon, hooked to 2 other places, but it's floating. Yeah. Thank you, Miss Rader. You also raised your hand for $1,000. Can you give me other examples of sesamoid bones found in your body besides the patella? We've only briefly talked about it.
Well, there's 2 in your big toe,
Mm-hmm. Yes.
and I'm guessing possibly your thumb too, since it's just like the foot.
She's dead on right, everybody. Your hands and feet are actually very, very, very similar, and you have 2 little mouse patellas in your thumb, and 2 little baby mouse patellas in your big toe on both sides. So I've got 4 patellas here, 4 patellas down there, and 2 big patellas on my kneecap. You've got 10 in your body. Thank you. Well done. And I also like how you piece together information there. Who can tell me what muscle attaches to the tibial tuberosity? Hopefully everybody. Miss Rader, please.
Your rectus femoris and your vastus lateralis, vastus medialis, and vastus intermedius.
All 4 quads insert into the tibial tuberosity? She's 100% right, everybody. Don't forget that. All 4 quads insert into the patella, and the patella is tied with a ligament right to the tibial tuberosity. And if this wasn't true, you wouldn't be able to extend your knee. You wouldn't be able to kick your leg out. There would be no Karate Kid. That'd be it. You would never be able to do his finishing move. You wouldn't be able to play soccer. You wouldn't be able to do a lot of things, by the way. But that is what the tibial tuberosity is. You can feel it on yourselves. And it is where all of these 4 quads attach into the patella, and the patella inserts in the tibial tuberosity. Yes? Yes. Okay. Thank you, thank you, thank you. Mr. Jones.
Oh boy.
Sorry, I'm doing like I'm checking it. Mr. Jones,
Oh,
what muscles insert into the tibial tuberosity?
Oh.
Yeah, I'm just making sure people are paying attention.
I went blank. Vastus lateralis,
Good.
vastus intermedius.
You're halfway there.
Oh. Man, I have such a blank brain right now.
Well, you told
But
me.
I promise I was following.
No, no, sir, you
and
were
I know
obviously
that-
listening. I was just, and I wasn't trying to pick on you. I just was randomly calling on people just to kind of check in. You told me vastus lateralis. If there's a vastus lateralis, there must be a vastus.
Intermedius.
Well, that's in between. If there's a vastus lateralis, there must be a
longus.
vastus.
Vastus longus.
Vastus medialis.
Medialis, yes.
Yep. And then there's.
Rectus femoris.
Yeah! Good job, sir. Thank you. Mr. Snell.
Yes.
Mr. Snell, what are the four muscles that insert here into the tibial tuberosity?
The rectus femoris, vastus intermedius, vastus laterus, and vastus medialis.
Yes, thank you. I had to kind of follow that. That's excellent, though. Thank you, sir. Thank you. Mr. Godot.
Yes.
Mr. Godot, sir, what are the four muscles that insert into the tibial tuberosity here?
Tibial tuberosity.
Yes, this bump on the tibia here.
Hold on. It's been a minute.
It has been a minute, sir. Yes.
Can I get a clue?
A clue is that I just asked this same question
Mr. Snell?
and to Mr. Jones.
Yeah, I heard it. I was in the bathroom, so I was trying to, yeah, I knew it was coming.
You knew it was coming. All right, hold on, sir. Listen up, because I'm going to call on you again in a second.
All right, sounds good.
Miss Everson.
Hello.
Miss Everson, hello. What are the four muscles that insert into the tibial tuberosity?
The vastus lateralis, vastus medialis. I can't think of the other two right now.
Well, there's one found between those two.
Between the vastus lateralis and medialis.
Yeah.
There's the vastus intermedius.
Yes, vastus intermedius, which means between those two. Yes. And then there's the really long one that goes up the femur. But it's not long. Sorry, I should have said long. That's going to throw you off. Starts with an R.
Rectus femoris.
Yeah, rectus femoris. Thank you, ma'am. One last question since I've got you on the line. Those all let me perform. All four of those let me perform this action. What is this action?
Oh, hang on. Let me minimize the screen so I can see it. Do it one more time. An extension.
Yes, the extension of the knee. Thank you. Or the tibial femoral joint. Awesome. All right, Mr. Godot. I'm back to you, sir.
I'm back.
Thanks, sir. What are the four muscles that insert into the tibial tuberosity?
All right. So it's vastus lateralis,
Yes.
vastus intermedialis, vastus medialis, and then rectus femoris.
Awesome. And what action do they let me perform?
So you can, extend?
Yeah.
Okay.
Extend the tibial femoral joint. Thank you, sir.
Right.
All right.
Thank you.
Thank you. Okay, so that's the tibial tuberosity, everybody. That lets all of our quads attach to it, right? And they really attach to your patella first, this sesamoid bone. And then the patella is actually hooked by a ligament to your tibial tuberosity, but that's what lets you kick out your knee. So what's interesting, if you'll notice, is a lot of the thigh muscles move your leg. All of the leg muscles move your feet. So things that live in one area tend to move something in another area. Like most of my thoracic muscles actually move my arms, right? Most of them don't move stuff here. They reach out and grab onto things that move them because muscles only do one thing. They contract and they pull. Super duper important. Your tibialis anterior is this muscle found on the front of the leg here. And this tendon is a dead giveaway that it is the tibialis anterior. We are going to get to it later and study it, but the tibialis anterior starts on the lateral side of the leg and inserts on the medial side of the foot. It crosses over the foot, and this will be very important later. It's also very important, Mr. Singletary, I'm calling you out, you don't have to answer, but you always ask questions about the year-end test. If I showed you a picture of a muscle that started on the lateral side of your shin, but had a tendon running across the foot and going to this side, 100% of the time, that would be the tibialis anterior. That's how you identify it. The peroneals are on this lateral side of the leg too, but they just stay on the lateral side and hook to this side of the foot. So the fact that the tibialis anterior crosses over the foot is an instant identifier. It's tibialis anterior. Yes, Mr. Singletary.
That kind of looks like Centaurus. What it does, the same thing, crosses over and comes over to another side.
You mean sartorius?
Sartorius, sorry.
Yes. No, don't be sorry. I'm just, just doing what teachers do. Yes, sir, yes. It has a diagonal effect to it. Yes. Very much like the sartorius, actually. You make a very good point. And it has kind of some similar effects. I never thought about it that way, but you're absolutely right. Ms. Carrillo, please.
So if it crosses over to the foot, like on the medial side of the foot, I forget what it's called. Is that called like the inversion flex?
Yes. So I'll try to do this with my hands, but if my hands are my feet here, it can cause you to invert. The peroneals, by the way, stay on the other side of the foot, so what do you think the peroneals allow you to do? Evert. I don't know if I said it right. Invert is what I meant to say. Evert. Yeah. How important do you think inverting and everting is to people? Yes, thank you, Ms. Severino. She's like, very important. Ms. Hendrickson, yes.
Oh yeah, I was just gonna say it's probably really important because when you walk on surfaces that are not flat, like your foot's gonna have to not be totally flat, so you need to adjust it like that.
Yeah.
To keep your balance and stuff.
This might be new news for all of you, but 100 years ago, all the way back to the beginning of time, there weren't sidewalks and streets, and things were not flat. And believe it or not, you actually had to navigate uneven surfaces. And if you have to navigate uneven surfaces and you don't have peroneals or tibialis anterior, you'll fall over. If you guys ever hiked on uneven ground, at the end your shins hurt. And that's because your body is constantly balancing and torquing your foot back and forth. Super important balancing muscles. Super important. So now follow me on this too. By the way, we're heading to the calves, but I just thought this was kind of interesting, stuff of highlights of things to come. Let's look at the back of the leg. From the back of the leg, you can see this from the front too, but what's really important, I want to point out two things to you that are very important. You have these bumps on your leg. You have what's called the lateral malleolus, which is a bump on the lateral side of your body, and you have the medial malleolus, which is a bump on the medial side of your body. The lateral malleolus is actually a bump, if you'll remember, which you probably don't anymore, a bump on the fibula. It is a bump on the actual bone of the fibula. And the medial malleolus is a bump on the tibia. And I've said in the past that these are pulleys. Pulleys are a way for force to change direction. So, if I have something that I'm pulling down here, I can cause it to pull something from over here over. It lets me change direction with force. It goes around a pulley. It's very helpful, right? And that's what your malleoluses do. So your tibialis posterior and your flexor digitorum longus, your flexor hallucis longus, live up here underneath the calf muscles, but their tendons come down around this medial malleolus to go underneath the foot and hook into the toes. Your peroneals or your fibularis come around this side to hook into your foot. And it allows them to, that allows them to go around a corner and affect your toes. So those are really pulleys for tendons to go around, so that when your muscles in your legs are pulling up, they can go around a corner and pull stuff down like your toes. That has to go around a corner, and that's what those pulleys do. So the malleoluses are very important, and some really good massage therapists too. I'm actually not one. I don't have this habit, but I should. They'll actually massage around the malleoluses. Not hard, kind of flat-fingered, but it feels really good. There's all these tendons and ligaments around there, and this is one of those things where I don't know why I always forget to do it, but it's super important. Actually, work around the malleoluses. It feels really good to people. There's actually a lot of tendon ligament action going on in there. And we've got lots of retinaculum wrapped around all that stuff to keep those tendons in place. What's retinaculum again? I forgot. Anybody know? Oh, well, it's probably not important. Did you guys all freeze on me? No. Don't freeze on me. Hold on, everybody. If you can hear me, I'm coming back. All right, can you hear me now? Good. I asked a question and like nobody answered. I'm like, nobody knows this answer. Then I realized nobody was moving. Miss Clayton, you raised your hand? No.
Yeah, retinaculum is like very thick fascia, and it surrounds that area to give it stability.
Yeah, it's ribbon-like fascia. A lot of it's about this thick, and it wraps around your ankles and such. Oh, okay, so did I.
Okay.
Yeah, but I just got back on.
All right.
So try. We'll see what happens. Sorry, Miss Korea was coming to tell me that she lost connection too. Okay, cool. So anyway, let me reshare my slideshow, and we'll see if we can keep moving on. Oh, except you know what? Guys, it's 9:15. It's a good time to take a break, especially if we're having some connection issues. We'll get a second. How about we meet back at 9:32? Yeah? 9:32. See you guys then. Be there, be square. Okay, and we're back. It's 9:32. When we last left you all 15 minutes ago, which feels also almost like a year ago, we were discussing the muscles of the leg. We're kind of reviewing some stuff, talking about little highlights of things to come before we actually talk about the three calf muscles and the popliteus, the key that unlocks the knee, which we haven't talked really about at all until today. We were doing a little bit of review. I was checking in with people just to make sure that they're here on the same page with me, that we remember a little bit of anatomy. Mr. Ma, just for review purposes, could you tell us the 11 muscles of the leg before we kind of kick it off here? Mr. Ma? Sir? You there? Talk to me. Going once? Twice? No? All right. Miss Abelos.
Yes, sir.
Miss Abelos, can you tell me the 11 muscles of the leg?
All right. You have the posterior side is the gastrocnemius, soleus, plantaris. You have your tibialis posterior, flexor digitorum longus, flexor hallucis longus. On the lateral side, you have the peroneus longus and brevis, or the fibularis longus and brevis, and on the anterior side, it's the tibialis anterior, extensor digitorum longus, and the extensor hallucis longus.
Oh my God. I love, not only that you said it so well, but I love that you told us each section and where they're located. Fantastic, thank you. Mr. Ma.
Yes, sir.
Can you tell us the 11 muscles of the leg?
11 muscles of the leg?
Yes.
Mm,
Miss Avalos just told them to us. I don't mean that. I'm not trying to rub that in your face. I'm just saying I'm asking the same question twice. So in your leg, remember you got 3 calf muscles. You've got 3 muscles underneath those. What are the 3 calf muscles?
Oh, okay. Gastrocnemius, soleus, and plantaris.
Good. There are 3 muscles underneath those.
I'm sorry. You said 3 muscles. On 3 of those.
Yes. So in the back of the leg, there's 3 calf muscles, but there's also 3 more muscles that are underneath them.
Oh, I think I'm late to coming back for a minute, so I'm missing something. I'm so sorry.
It was the most crucial minute of the entire program.
Yeah.
I'll come back to you, sir. I'm going to come back to you.
Okay.
Mr. Singletary.
Yes, sir.
Mr. Singletary, can you please tell us the 6 muscles of the posterior leg?
6 muscles. Okay, that's 6 in the back.
Yes.
So hold on. Let me think. Okay, you got your tibialis posterior.
Tibialis posterior.
Your flexor digitorum longus and your flexor hallucis longus.
Yes.
And
then your 3 calves.
Oh, gastrocnemius, soleus, and plantaris. Sorry.
Excellent. What are the 3 muscles of your anterior leg?
Okay, the anterior would be the tibularis and anterior.
Tibialis anterior.
The tibialis anterior. Your the extensor digitorum longus and the extensor hallucis longus.
Excellent. And what are the 2 muscles of your lateral leg?
That's on the sides.
They run right along the fibula.
Oh, the fibularis brevis, and fibularis longus.
Excellent. Also known as peroneals. Thank you, sir. Thank you. Thank you. Miss Young.
Hello.
Miss Young, what are the 11 muscles of the leg?
The gastrocnemius, soleus, plantaris, tibialis posterior, flexor digitorum, flexor hallucis longus, tibialis anterior, extensor digitorum longus, extensor hallucis longus, and fibularis brevis, and fibularis longus.
And what's another name for the fibularis muscles? Nope. That's not it.
There's like people talking. Does it start with a P? I want to
Yes.
it
That's
is?
okay. No, it's peroneals. That's good. It does start with a P. You did good. Thank you, ma'am. That's good. Yeah. Miss Green.
Hello, mate.
Hello, Miss Green.
I'm sorry, I had to come back on like a goofy note.
I like it. What?
I'm all woke now. I took a shower.
There's a dramatic difference between when you just wake up and after you've had a shower.
Yeah.
You're like, I'm alive. Miss Green, what are the 11 muscles of the leg?
Okay, so posterior is gonna be plantaris, soleus, gastrocnemius, tibialis posterior, flexor digitorum longus, flexor hallucis longus, and then anterior, the 3, tibialis anterior, extensor digitorum longus, extensor hallucis longus, and then the 2 on the side are peroneus longus and peroneus brevis.
Beautifully said. By the way, everybody, I hope if you can see my hand, if this was your foot, if my toes go out like this, it's an extension. Well, the muscle to extend me would have to be in front. That's the only thing that can lift them out. So the anterior muscles are extensor digitorum longus and extensor hallucis longus. Underneath, this is a flexion. Those muscles would have to live in back. That would pull my toes under. So you got flexor hallucis longus, flexor digitorum longus. Very well done. Thank you, Miss Green. Mr. Ma, do you want to take another stab at this? All right. Mr. Ma, what are let's start with the back of the leg. The posterior leg, the back of the leg has 6 muscles. 3 of them are calf muscles. What are those muscles?
Okay, so it should be 3 calf muscles like gastrocnemius, soleus, plantaris, and tibialis posterior, flexor hallucis longus, flexor digitorum longus.
Beautiful. Now in front of the leg, the anterior leg, there's 3 muscles.
Okay, so there are tibialis anterior, extensor hallucis longus, extensor digitorum longus.
Yes, and then on the side of the leg, the lateral side of the leg, there's 2 muscles.
So it's proners, right?
Yeah, peroneals. Yeah.
Peroneals longus, peroneals brevis.
Yeah, and I apologize, by the way. You're right. It's all right. It doesn't matter at all. When we call them the peroneals together, we're just like, oh, those are the peroneals, or the peroneus longus, peroneus brevis. So that's why you heard me say it 2 different ways. But that's not important. Don't worry. Okay. You have redeemed yourself, sir. Good job. Thank you. Yeah, that was good.
I was washing my dish, so this is why I come back. Sorry for a minute.
It's all right. It's all right.
Thanks, sir.
All right. Let's talk about the calf muscles, everybody. Oh, Mr. Craven, I haven't seen your face in so long. Oh my God. Yeah, you're not looking half bad. Oh, pizza. Breakfast of champions. Surprised you don't have a beer open there. Yeah. He's like, I might be off camera. What do you know? All right. Let's actually talk about the calf muscles. This is where we're trying to head to. Okay. All right. Here is the beautiful calf muscles, all right? I want to point out some really key features. On what I believe is your left-hand side, you will see the most superficial calf muscle, which is the gastrocnemius, right? The gastrocnemius is what gives this beautiful shape to people that have really well-defined calves. You see this upside down, well, this W. I was about to say an upside down M, but an upside down M is a W. Anyway, so stupid. Anyway, this W shape under here, and you see that on people's calves that are well-defined. And the reason you see that is because the gastrocnemius is the most superficial. If we were to, let's say, hold a random student down like Mr. Richards and peel the flesh off his leg, we would first see this muscle. This would be the first muscle we see. I just want to explain what I mean by superficial, right? In this picture over here, they have cut part of that muscle apart so you can see the stuff underneath. And what we see underneath is the soleus, second calf muscle, and this little adorable muscle belly called the plantaris. Now, make no doubt about it, the plantaris, which has the longest tendon in the body, I think, basically, depends how you count tendons, but this tendon goes all the way down and becomes part of the calcaneal tendon. The gastrocnemius becomes part of the calcaneal tendon, and the soleus back here, believe it or not, becomes part of the calcaneal tendon. They all weave into the calcaneal tendon, which is your Achilles tendon, which goes into your heel, which is why these 3 muscles create a plantar flexion. Now, the gastrocnemius and the plantaris do something else really nifty. They go across the knee up here, which is why they can help in a flexion of the knee as well. But anyway, we're not going to worry about that right now. The soleus does not go across the knee. By the way, you'll notice the soleus is what gives width to your leg. So when you see somebody with really wide calves, that's probably their soleus. Their soleus pokes out on both sides. And you can actually usually see it on most people from the front and the back, poking out the sides. Anyway, if we cut this gastrocnemius apart and we uncover stuff, we did uncover the plantaris, but we also uncover this strange little muscle here called the popliteus. And its job is really to slightly rotate the knee and flex it to unlock it. So the popliteus is the key that unlocks the knee. The popliteus is the key that unlocks the knee. Because you remember I said, if I've got a muscle, it's very hard to visualize, but if I pull as hard as I want on this tape here, make it where you can see the tape. Believe it or not, it's not going to get my arm any closer. It just pulls it like this. I have to bend at the elbow before it's got the angle to pull it. The key that unlocks the knee is in here, and it pops the knee out. Because once you pop the knee out, you can start to pull. The hamstrings can't kick in until the popliteus unlocks the knee. And it actually does that by slightly rotating it and unlocking it. It really is why it's called the key that unlocks the knee. And that's the popliteus. It's not usually present in lots of structural problems because usually it just does its job. But if it doesn't unlock your knee and you're standing straight up, it's very hard to kind of get your hamstrings to kick in. Miss Carrillo, please.
What I looked on the internet, because I needed to do a little bit of the research, it said that when the knee is in full extension, the femur medially rotates on the tibia to lock the knee joint.
Yeah.
And thus the popliteus begins its knee, or it unlocks the knee by laterally rotating the femur on the tibia. Is that
yeah, or medially rotate. Well, let me think. Or medially rotating the tibia on the femur. Do you know what I mean? Depends on which way you're saying. One's going one way and one's going the other way. But yes, the idea is that your body is your body's really neat. And one of the things we have to be able to do is stand for long periods of time so that I can lecture people and teach them anatomy. And so Mother Nature gave me these knees that when I actually go up like this, they rotate ever so slightly and kind of lock. They kind of fit here. Now, we don't normally do this when we're walking or anything like that. We do it when we're standing long periods of time. Kind of like horses can sleep standing up. We have a little bit of ability to do that. And this popliteus goes like this. Click and bend. And once it does that, it kind of unlocks my knee and my hamstrings can kick in and pull. And so that's why you're absolutely right, Miss Creel. 100% right. And it's called the key that unlocks the knee. So if I were to ask you, like if I were to ask Mr. Craven, what's the key that unlocks the knee? He would tell me after he swallowed his pizza. You're smart.
That would be the popliteus.
Thank you, Mr. Craven. That's exactly what he would tell me. He would be like, that is the popliteus. Yeah. Awesome. That's the key that unlocks the knee. So this gives us a real big view of the backside leg. And I know I haven't been asking you, I guess you could argue this is the 12th muscle on the back of the leg. I haven't been emphasizing it because it's not a major structural muscle, but I probably will. So we'll probably add it in as the 7th muscle on the posterior leg compartment. Yeah. And that's all of them, I promise. I'm not going to sneak some other little one in there. So, that's that. Let's go and look at these separately. I love it. Okay. This is really hard to see in this slide, but this muscle that runs right over the kind of the shin bone and crosses over the foot, goes from a lateral to a medial side, is your tibialis anterior. And here's your fibularis longus or your peroneus longus that stays on this side. And they are showing you here, here's your fibularis longus, your peroneus longus. It's going around a corner here. What's this corner? The lateral malleolus. It's going around this corner to hook here. Mr. Overman, please talk to me.
I don't know if it's just me, but I don't see your mouse and what you're pointing at.
Okay. Because my pointer's not in the right place. It's not just you, it's me. Here is the malleolus, sir, which is a bump on the fibula in this case. There's a medial malleolus bump on the tibia. And this is the fibularis longus. Its tendon going around this corner to go underneath the foot and hook underneath here. By the way, here's the fibularis brevis right here. This is the reason, by the way, we usually just call them the fibularis, because they feel the same when you're rubbing down the side of the leg. It feels like all one muscle here. The longest is actually up higher, the brevis is down lower, and they both kind of head down here. Although one runs underneath the foot, the other one doesn't. But this is the malleolus. Can you see this, sir? I hope.
Yes.
Good. Sorry about that. Okay. Moving right along. I love pictures like this for many reasons. As a massage therapist, it gives you an idea where this stuff can be found. But it also shows you how much the size of the leg is actually made up by soft tissue. Not much of that is actually bone. Most of it is soft tissue in there. Okay. We're going to get past all this. We'll come back to this, by the way, but let's talk about the gastrocnemius. The gastrocnemius by itself is one of the most important muscles of the leg. It does grab onto the calcaneus, your heel bone, and when it pulls, it causes my foot to go down. What do we call that when I stand up on my tippy toes? What's this action of the foot called? Miss Hendrickson.
A plantar flexion?
It is called a plantar flexion. All three calf muscles help you do a plantar flexion. Actually, 6 of the 7 muscles of the back of your leg help you do a plantar flexion, because plantar flexions actually take a lot of power to do. It's a lot to lift my body up. And this lever actually works against me. This lever is built for speed, not power. Anyway, the gastrocnemius is possibly the most important of your back, of your posterior leg muscles. Why? Who can tell me? Mr. Jones, please.
Something about, like, it helps pump blood?
That's solely it. By the way, they all do.
Oh, never mind.
By the way, you're not crazy. They all do. Every muscle does.
Gotcha.
But the soleus is the one that's called the second heart.
Yeah. Oh, I was wrong about that one. Never mind.
That's all right. It's all right. You're remembering bits and pieces. I'm happy about that. Miss Correa, why is the gastrocnemius so darn important?
I don't know if I'm right, but it's like a very powerful muscle that crosses over 2 joints.
Yeah. And she's right, by the way. It crosses over 2 joints, which I've been emphasizing since almost day 1 in this class, right? Which makes it part of what? It's part of an entire system that I've only mentioned here and there that has to do with, yes, Miss Rader.
Is it like the fascial chain or
Yes.
something like that?
It is part of what we call the back fascial line. Muscles don't work in isolation, just like you guys don't work in isolation. Muscles actually don't work in isolation. When you first come to class, we teach you as though they work in isolation. Other massage schools teach you as though they work in isolation. But advanced anatomists know for a fact that they work in long fascial chains. And the gastrocnemius is what connects your plantar fascia. Your plantar fascia is the fascia underneath your foot, feeds into your heel. That becomes the calcaneal tendon, which becomes the gastrocnemius, which goes across your knee. And when it goes across your knee, it fascially connects into your hamstrings. Your hamstrings fascially connect into your hips. Those fascially connect into your longissimus especially. And that connects your head to your toes. This is extremely important. If you have a tall pole and you want to keep it upright, you've got to attach wires to that pole to go all the way from that pole to the ground. And even the shortest of you in this class are relatively tall poles. Your feet are about this big and you're trying to erect this really large structure on top of it. We don't think about that, right? We look in the mirror and we're like, oh, I could be a little slender or whatever. Well, at least I do. But the fact is, my body is very tall for the size of the foundation. And that requires fascial lines to connect me through that whole thing so I can stand upright. They also do other really amazing things. They conserve power. They let me absorb force. There's a reason we don't tear ourselves constantly with all the forces that go on. That's because your body will actually distribute it out through fascial lines. And the gastrocnemius is part of your back fascial line. We're starting to change this course right now to start to talk to you about things in long chains. It's not just about, that's the biceps taps. I got it. Those of you that have been staying on top of your anatomy are going to be very rewarded now because we're going to start actually tying it all together in these long fascial chains. And once again, the back fascial line is the plantar fascia that goes from your toes to your heel, gastrocnemius, hamstrings, gluteals, depending on how you want to look at it, longissimus, all the way up to your head. And that's how it gets all the way up to your head. That is your back fascial line. Okay. Moving right along. By the way, since the gastrocnemius crosses over two joints, you can see that it can do two actions. It does a plantar flexion, that's its main job. Lets you stand on your toes. But it can also help you flex the knee. It also can help you flex the knee. And this is why we very judiciously rub across the knee. Not in the knee pit, but across the edges of the knee. Miss Clayton, please, talk to me. Miss Clayton? You raised your hand, Miss Clayton?
Sorry, I was talking, but no one was hearing me, so it's my mute button is on. Every time I think I have it down between flexion and extension, I get confused. So you said when you raise on your tippy toes, it's flexion, and in my mind, I'm thinking I'm extending because I'm elongating, but I'm not. I've
got good news and bad news for you.
Okay.
The good news is you actually understand the concept really well. The bad news is they named foot movement really crappy.
Okay.
So this kind of pisses me off. I don't know why. It shouldn't make me mad, but they call this a plantar flexion and they call this a dorsiflexion. So they use the word flexion both in ankle movements, which really upsets me. You're 100% right. This should be called an extension along with the toes. And so that's why you're getting so confused, and you literally just have to memorize this. And then it's also confusing because the knees work backwards. Anyway, essentially flexions close an angle and extensions open an angle. And usually happen in front of us, but not with the knees. And when you get to the foot, they were like, screw it. Forget all that stuff. We're just going to call this plantar flexion and this dorsiflexion. The way I remember it is if I plant my toes really hard, I would stand up on them, and that's a plantar flexion.
Okay.
If I want to stop a door, have you ever put your foot out to stop a door? Like your heel down? That's a dorsiflexion.
Okay.
Door.
Yeah.
Dorsiflexion. That's how I remember it. But anyway, no, you're 100% correct, and you're not the first person to think this, and it really messes people up. It's annoying.
Okay. Thank you.
Miss Carrillo.
And a way that Ms. Borch taught us when she was teaching here was that plants are on the ground. If you're flexing towards the plants.
Yeah. And by the way, dorsiflexion, somebody said fin. They're absolutely right, too, on that. Dorsi means back. The top of your foot is called the back of your foot. Don't ask me why. Anyway, and so in dorsiflexion, the back is coming closer to you, or the dorsal fin is coming closer to you. You're right. And on a plantar flexion, you are stepping on the plants. Yeah.
Yeah, that's helpful. Thank you.
But it is annoying. All right. So, gastrocnemius. And moving right along, let's go to the soleus. If we remove the gastrocnemius, deep to the gastrocnemius is the soleus. The soleus does not cross over the knee. It can only do one thing all day long. It can only do one thing all day long, and that's plantar flex. It is a powerful plantar flexor, but it is not part of the back fascial line because it doesn't get any of the fascia across your knee. So we don't include it in the back fascial line, but you really need it to move your ankles. It's powerful. The soleus is also considered to be your second heart. because the pumping action of the soleus actually helps pump blood back up to your heart. Blood, if you think about it, gravity tends to pull blood downhill, right? And it's hard to actually get it back up to your heart. And the walking action, like what Mr. Overman does in the morning, actually helps create a pumping action because his soleus sucks in blood and pumps it back out. And it helps with venous return, which is why they call it the second heart. I remember this by heart and soleus. Yes, Mr. Overman.
So my fellow veterans should know what I'm talking about, but in the military, when people stand with their knees locked too long, they pass out. Is this why?
I don't know. I'm very aware of this phenomenon, but I don't know why.
Okay. I had the thought earlier when you were talking about it, and I was like, maybe humans aren't designed to stand.
Well, stand still for so long. That's a really good point, but I hesitate to answer that one. But I've heard of this all the time. People pass out from standing too long. You're absolutely right. So that's your second heart, your heart and soleus. That's why it's nicknamed that. By the way, I don't know how much venous return or whatever, but these are kind of important things. This is why walking, one of the reasons walking is so good for you. It actually stops stagnant blood flow in your body and things like that. Yeah. So, Miss Osuna.
Yes.
Miss Osuna, which muscle in the body is considered to be the second heart?
The soleus.
Thank you, Miss Osuna. Mr. Bose.
Sorry, my screen out.
That's
here.
okay. Mr. Bose, it's fine. Mr. Bose, which muscle in the body is considered to be your second heart?
The soleus.
Awesome. Thank you, ma'am. All right. Here's the bonus question, open to anybody. So, one of the reasons we learn anatomy is so that we can get to muscles that need to be rubbed. One of the problems with rubbing the soleus is that the gastrocnemius is on top of it. And if the gastrocnemius is tight, it's like trying to massage trying to massage a steak through an even tighter steak. Now you can get to the soleus from the sides, medial and lateral. And I often do rub a leg and kind of pinch it on the sides and rub it like this. That'll help you get to it. That's true. But if I want to get to the soleus through the back side, through the posterior side, through the gastrocnemius, what should I do to help get the gastrocnemius looser? I know massage will make it looser. What should I do to get the gastrocnemius to quit stopping me from getting to the soleus? Yes, Miss Clayton.
Can you, like if you're laying supine, you could bend the knee so that it's relaxed, the calf portion is relaxed, or if you're prone, then you bend the knee.
It's the same. Well. It's the same bending either way. Yeah.
Yeah.
You flex the knee. Yeah.
Yeah.
So you're 100% right. What Miss Clayton did was she said, "I know the gastrocnemius runs across the knee. I know that it creates a flexion, right? When things create a flexion and we flex for them, they're loose. So she puts the knee in a flexion. That does nothing for the soleus. Soleus doesn't go across the knee, but it makes the gastrocnemius loose. And now it's mushy and squishy, and I can push through it and get to the soleus. This is one of the reasons we study anatomy. So you flex the knee to get to the soleus, right? A lot of massage schools teach you, we do too here, I do, when they're face down, when they're prone, to bend the knee and put it up on your shoulder and rub the calf. We do that because it's convenient, but also it helps to loosen the gastrocnemius so we can get into the soleus, because the soleus works really hard. Yeah. Cool, cool, cool. So anybody here done seated calf raises in the gym? I know Mr. Jones has. Anybody else where you sit down that little thing, you put the plates on there and you do little toe lifts? Yeah. Yeah, seated calf raises. Which calf muscles does that work? Mr. Jones.
The two that are the one that doesn't cross over the knee joint.
Yeah, which one is that, sir?
The plantaris. Or no, soleus.
Thank you. Sir, which is the
I
second
don't know
heart?
why plantaris came
Which
up.
is the second heart of the body, sir?
The soleus.
Cool. Just throwing that in there. Yeah. So, guys, what happens is when the knee bends, the gastrocnemius is loose, so even when it contracts, it's not enough to really pull on that heel very much. It does a little bit. So you've actually disengaged it. The only thing that works in seated calf raises is the soleus. And it's actually one of the reasons that really good personal trainers recommend you don't do a lot of seated calf raises. Because the soleus is always engaged. No matter how your knee's bent, no matter what, if you do a plantar flexion, the soleus is always working. But the gastrocnemius and the plantaris aren't always working. So we don't want to further disengage them and give the soleus even more work to do. We'd like to keep them all engaged together. Which is why they usually recommend standing calf raises or something called donkey calf raises. Because really you might as well work them all three together. Anatomy. Okay. So far we've got the gastrocnemius and the soleus. They're together as a unit. Didn't they do the plantaris here? They did. Here's the plantaris. Check out this guy's thumb on here. That's the belly of the muscle. That's the part that contracts. All this down here is tendon. So the plantaris is a very weak plantar flexor. There's a lot of theories about why it even exists. And they're all pretty good theories depending on what your theories are about other things. Some people say it's just leftover evolutionary. But some of the theories I like actually even better are is that it helps you do small tweaks to your heel. Because we don't realize what a finesse it is to be able to run around and all that kind of stuff. And a tiny little pull one way or the other makes a big difference. And so it really could be that the plantaris is kind of a thruster. I mean, like a little thruster rocket on a ship. It kind of helps you tweak the other muscles and get them to pull the right directions and things like that. But it is a very tiny muscle. The belly of it's about the size of your thumb, and it's got this massively long tendon. Yeah, and they're showing it separate here, but please, 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 it becomes part of the calcaneal tendon, right? If we remove the skin from somebody here and look to the back of their leg, we would see one tendon down here. The plantaris tendon becomes part of the calcaneal tendon. The soleus tendon becomes part of the calcaneal tendon. The gastrocnemius tendon becomes part of the calcaneal tendon. They're showing it to you separately here to make a point about this muscle, but it's not this neat and tidy. They all feed down, just like your quads all fed down into the patella. Okay? Anyway, this is your plantaris. And it's found right back here. Most people don't even mention this thing. If you go talk to your personal trainer and say, what are the 3 calf muscles? Your personal trainer will most likely look at you and be like, there's only 2 calf muscles. And they're not exactly wrong, right? This is not something that bodybuilders are worried about working. It gets worked anyway when you work the gastrocnemius and things like that. And if you look at it up here, hold on, I gotta get my cursor back. If you look at it up here, believe it or not, when you're rubbing somebody, it feels like just the top part of the gastrocnemius on the lateral side. It's very hard to differentiate up here. It's very tiny. But that's the plantaris. So all 3 calf muscles insert into your heel. All 3 calf muscles insert into your heel, which is how they create a plantar flexion. And then last, but certainly not least, but probably deepest, is the popliteus, which is essentially on the back of your tibia. It grabs up, to the fibula. Up to the femur. I apologize, up to the femur. And it helps to medially rotate and flex the knee. It really just helps to unlock the knee. You don't need to memorize all that. It just helps to unlock it, to flex it just a little bit, to kind of twist it a little bit and flex it so that you can unlock your knees and not pass out. Yeah? So the key that unlocks the knee The key that unlocks the knee is the popliteus. Yeah? Miss Stevens. Miss Stevens? Dear Miss
Yes.
Stevens? Oh, Miss Stevens.
Sorry.
Oh, you're okay. Miss Stevens, what is the key that unlocks the knee?
Popliteus.
Yeah, and just since I have you on the line, what is the second heart?
Is it the plantaris or the soleus?
Soleus.
Okay.
Heart and soul. Heart and soleus.
Okay.
That's how I remember. Good. Cool. Thank you, ma'am. Thank you. All right. By the way, guys, I do apologize. Like, I have to kind of call on you and, make sure you're paying attention. But I realize it's very hard when somebody calls on you and they haven't talked to you in 2 hours and then asked you a random question. I get it. But get used to it because I'll keep doing it. Okay. This is just a nice picture of all three muscles again. And that's it. Let's stop sharing this. Okay. So, questions, comments, thoughts? Yeah? Yes, Miss Abelos, please talk to me.
Sir, when you were talking about relaxing the gastrocnemius and the soleus soleus, is that an example with flexing the knee? Is that an example of reciprocal inhibition? Is that what that is? Is that an example of that?
No, I appreciate you asking that. It's a really good question, but it's not. So, I'm trying to think of the best way. I'm going to use my bicep and tricep because I think we all understand that pretty well, right? We all know that I have a bicep up here, right? It's on my anterior arm. Right now it's on top of my arm, but we still call this the anterior arm. And this bicep, if it contracts, my arm flexes. On the back, I've got a tricep. And if it contracts, my arm extends. Reciprocal inhibition is this automatic thing that you can all override. In fact, you override it all the time. You can consciously override it, but if you don't say anything, when I tell my body to curl, when I say, hey, flex this thing, it sends an automatic signal and says, triceps, take a break. It tries to shut them off. Your brain actually tries to shut off, your nervous system actually tries to shut off signals to your tricep so that it doesn't stop me. And that's reciprocal inhibition. Reciprocal inhibition says that your nervous system tries to shut off the opposite side so that it won't stop you from a movement. Now, can I override that? Yes. In fact, when you're flexing and showing off your massive biceps, you're actually firing both at once. I'm actually overriding reciprocal inhibition, and you just do it without thinking about it. But reciprocal inhibition is that when the front of my body's moving, it tells the back of my body to get out of the way. That's reciprocal inhibition. What I was talking about, just to give you a very similar example, underneath this bicep is my brachialis. Right now, my bicep's kind of tight just because it's stretched out here. Now, if I flex it, that makes it even tighter. But if I just lift it, it's loose here. And so now it's easier for me to get down through it into the brachialis because I've made the rope loose. And that's something completely different. That's just, I don't even know what the name is for that. That's just us knowing anatomy and kind of getting that rope, that muscle loose because we bent what it was supposed to bend, but it didn't do it. And so it's got extra length because it didn't take in its own slack. That makes sense? Oh, okay. Mr. Richards, please.
So that's passive range of motion, right?
Yes, sir. And it does get confusing, right? Because if it was active, if I was active assisting, it would be even tighter than ever. You don't want me to flex and try to get down here. But if I'm passive, the bicep didn't shorten here, and so now you've got this loose rope, right? The difference is, I know I'm running this in the ground, but it's really important because we use it for all sorts of stuff. If my muscle contracts, it tightens up and it stays tight. But if I do it for it, you get this. You get a muscle that never shortened, but it's in a shortened position of the arm, right? I'm not flexing right now, so my bicep should be, it is. Look, it should just jiggle around. Yeah, and we use that to get to deeper layers of muscle. Yeah, and that is passive range of motion, right? the therapist is doing work, but the client is passive. Yeah, well said. Passive range of motion. This is going to be confusing, but if you use passive range of motion to create the action the muscle is supposed to create, it'll be in a very soft position at the end. Whew. Okay. Any other questions, insights, thoughts, ponderances? Let's see. Yeah. Yes, talk to me. Miss Creel.
I wanted to go back to the what are they called? The malleoluses.
Yeah, malleolus. Malleoluses.
I wanted to make sure I understood. So, the peroneals and the tibialis go through the malleoluses?
Go around them.
Around. Oh. Thank you.
Like, if I wanted to lift this, I can't hold everything here. Let's see if this thing will follow me. Come on down, buddy. Okay, maybe. If I wanted to lift this cup of coffee up, but I only had a muscle out over here, I needed to go around a corner. And then by pulling over here, the coffee mug would come up, right? I didn't spill any coffee. It's empty. So malleoluses are really a pulley system. And they allow you to go around a corner. So that stuff up my leg can go around a corner and still pull on my toes. Yeah. Cool. Love it. All right. I'm going to release homework. We will be doing lots more review because you guys need it. But in the meantime, you have 2 homework assignments. You have a 25-question test on what we just talked about, the calves and the popliteus. And you are going to be doing the chapter questions from chapter 30 of your massage therapy book, which is on the urinary system. Woo! Urinary system. We only briefly discuss it, by the way. Massage doesn't directly affect it, but it kind of indirectly affects your urinary system because essentially you squeeze lots of water out of people's bodies when you're massaging them, and they eliminate it through the urinary system, which is super important. But anyway, so we'll be going over that tomorrow. So you should have 2 assignments right now. 25-question test and matching from chapter 30 of your massage therapy textbook. Yeah? And I'll be here if you need me. Yes, Mr. Singletary.
2 questions. If we went to that Arizona